Welcome everyone, and thank you for attending today's webinar, Advancing Equity in Early Childhood Policy. It's the first in 4 of our webinar series that we are excited to bring to you. Let me introduce myself. I'm Allison Gertel Rosenberg, Vice President of National Prevention and Practice at Nemours Children's Health. And I would like to thank our partners who are on the phone with us from Healthy Eating Research, and in particular, Megan Lott and Lindsay Miller, for their partnership in planning and hosting this webinar series. And I'd like to thank all of you for taking the time to join us today in what we know are really busy schedules. Before we begin, I want to cover a few housekeeping items. First, we will be recording this webinar and sharing it publicly. We will also share the presenter slides after the webinar. And you can submit your questions, which we encourage, at any point during the webinar using the Q&A tool, and we will respond to them as time allows at the end of the webinar. Moving forward, thank you. Nemours Children's Health, just to share a little bit about who we are, is one of the largest integrated pediatric health systems in the country. Really everything we do, from our medical care, our research, our education, prevention and advocacy efforts, is really focused on kids. Our goal is to help children everywhere grow into healthy adults. And to do this, we think of health as more than just medicine. We think about good health that involves education, food, housing, family stability, emotional well-being, equity, justice, and more. And that's really why we think about going outside of our walls to really reach kids where they live, learn, and play. And we found a great partner with Healthy Eating Research, who we've worked with for years. But just to remind you all, ATR's mission is to support and disseminate research on policy, systems, and environmental strategies that promote healthy eating among children and advance nutrition and health equity. So in 2009, a partnership between Nemours Children's Health and the Centers for Disease Control and Prevention created Healthy Kids, Healthy Future, which is really a national movement to promote health and prevent obesity in children's birth to 5. And the world has definitely changed since 2009 in so many ways, but really we have seen a growth in the collaboration between the multiple sectors that are reaching young kids and families. But this expert group of national leaders from obesity prevention and early care and education really look to foster collaboration across those sectors, to begin the conversations that would support the type of work that needed to happen at a systems, environmental level to really change the trajectory for kids. And we've hosted a number of national conferences in 2009 and 2016 and had high hopes for a 2022 in-person convening, but instead are really working through these webinars to continue to advance policy, practice, and research in early childhood health promotion and obesity prevention. And through our discussions with our partners at Healthy Eating Research about the impact of the pandemic on the health and well-being of young children and families, we really determined that there was still a need for both the obesity prevention and early care and education fields to take stock and assess new opportunities to advance child health equity by better addressing food insecurity and childhood obesity. The opportunities are there to do the work. We just have to do it in different ways. And so to foster this discussion, we are hosting this series of webinars, 4 of them, on how to leverage early care and education settings to achieve equitable health outcomes by highlighting opportunities and advances in policy, research, philanthropy, and innovation. And we hope that you will join us for all of the webinars, and we'll make sure that post this webinar, we share information on the upcoming webinar events and how you can register. But during today's webinar, the one that you have already decided to join, and as I said, we are so happy you are here, we have a couple of things we want to cover. The welcome, the presentations, and I will introduce each of our speakers, but I am so excited to share the work of Daniela Gertali, Carrie Doima, Stephanie Scarmo, and Jerry Hinchey before we head into a bit of a moderated conversation, and then of course, your questions and feedback from the panelists on your pressing issues. So with that, let me introduce our first speaker, my colleague, who I have the pleasure of working with every day, Daniela Gertali. Daniela is the director of the Office of Child Health Policy and Advocacy at Nemours Children's Health. In this role, Daniela oversees policy development and advocacy to advance Nemours Children's federal agenda through engagement with Congress, the administration, and national experts. Daniela and her team forge relationships with politically diverse congressional delegations, as well as national organizations and health systems, all in favor of promoting policies that support the healthiest generations of children. Welcome, Daniela.
Hi, Allison. Thanks so much. It's such a pleasure to be here today. So today I will spend a little bit of time providing a quick overview of some actions that have occurred at the federal level over the past few years that relate to food insecurity, obesity, and equity, and then highlight some upcoming opportunities as well. Next slide, please. So as you all know, the COVID-19 pandemic has had far-reaching impacts on children and families, social impacts, health-related impacts, economic impacts, and certainly we have seen that communities of color have been particularly impacted, especially when it relates to issues such as poverty and food insecurity. We do know, of course, that there is a strong connection between many of the anti-poverty programs that we have and food security, and that they have a strong role in promoting access to healthy foods. And certainly the Child and Adult Care Food Program, the SNAP program, the WIC program, school lunch program, they've all played really important roles, especially over the last couple of years, in ensuring that children and families have access to healthy foods, especially as we've been working together as a nation to weather the impacts of the pandemic. And Congress has responded by providing some increased flexibilities within these programs and greater investments within the programs. So I'll take just a minute to highlight a couple of those investments. So the Families First Coronavirus Response Act did support increased food assistance to millions of folks by providing greater flexibility through the SNAP program, also greater investments in the WIC program. The American Rescue Plan, among many other things, had some very important poverty reduction provisions, including temporary expansion of the child tax credit and the child and dependent care tax credit. So while temporary, those were important improvements that potentially could be expanded again in the future, hopefully. And then on the administrative side, just highlighting a couple things as well, the administration did revise the Thrifty Food Plan, and that's used to calculate SNAP benefits and did increase those benefits. And certainly we've seen many different waiver authorities to provide more flexibility, especially through the school lunch program. Next slide, please. So I wanted to highlight a few bigger picture upcoming opportunities on a number of fronts. The first one being through the federal appropriations process, and this is certainly something that my team and I spend a good deal of time tracking. We're still early in the FY23 process this year, but a couple of programs that do have particular impact on the early care and education sector are first, the Child Care and Development Block Grant, or CCDBG, and secondly, the National Early Child Care Collaboratives Program. So CCDBG, of course, is very important because it's a program that helps provide subsidies to make childcare more affordable. And the Biden budget actually proposed a very large, $1.4 billion increase for this program. And the National Early Child Care Collaboratives Program is a very targeted program. It focuses on promoting healthy eating and physical activity within the early care and education sector through a combination of systems level changes, as well as direct opportunities to provide technical assistance and training to providers and to others within states. And for this program, the administration has proposed flat funding. So as the appropriations process continues throughout this year, there's certainly more opportunities to engage, to continue to encourage promotion of programs like these that really do focus on creating healthy environments and access to care within the child care setting. Also linked to appropriations is the White House Conference on Hunger, Nutrition, and Health. So the fiscal year 22 appropriations process actually provided $2.5 million to call for this conference. One of these conferences has not happened in over 50 years. And this type of conference is just a really good platform for highlighting bright spots, barriers, new and innovative approaches, best practices. So certainly one that really can help folks come together to think through, where do we want to go in the space of equity, nutrition, healthy eating, physical activity moving forward. So certainly one that I encourage folks to pay attention to and to engage in. And then there are two big reauthorization bills as well that I wanted to quickly touch on because I suspect others might cover these as well. So it's unlikely that either of these bills would be reauthorized this year, but they are up for reauthorization next year. And I think both of them, again, have great opportunities. So some of the solutions that are highlighted, for example, in something like this White House conference, could be legislative and could make its way into these bills. And these programs do really help to make major changes for things like the SNAP program or the National School Lunch Program or the CCDBG program. So all of those programs could be updated, funding could increase for them. There could be the opportunity to pilot new and innovative approaches. So certainly, again, areas where folks who are interested in programs that have an impact on obesity and equity could certainly make some policy recommendations. Next slide, please. In addition to those bigger picture appropriations and authorization opportunities, there are a few more targeted approaches that I thought would be also worthy of conversation that I'll start to describe on the next slide. So the first is the Reducing Obesity in Youth Act. So this is a bill that's been introduced by Senator Booker and Congressman Cohen. And it's similar to the National Early Child Care Collaboratives program. And basically the bill would provide continued grant funding to support states that are interested in making improvements in the healthy eating and physical activity infrastructure within the early care and education sector. So again, this combination of bigger picture systems changes. So things like promoting healthy eating and physical activity in quality rating improvement systems or in professional development systems. At the same time, thinking about what you could be doing to provide targeted technical assistance, even on topics like equity, directly to providers. So if passed, this bill really would help to provide some continued structure and focus on improvements that can be made within the ECE sector. And certainly those improvements to support healthy development and increase access, equitable access to childcare programs that have those types of policies in place can make a really big difference in long-term health. Next slide, please. So moving from the ECE sector specifically to a broader focus on how do we connect sectors, the Link to Address Social Needs Act is a bill that would authorize funding to states to help create networks, so multi-sector networks to identify and refer folks to services. And it does specifically have a reference to the childcare sector and child serving sectors in the bill, which we thought was really important because the early care and education sector and schools and other sectors that serve children really do, of course, have an important role to play in promoting healthy development. Was linked electronically with others, there would be an opportunity then to really come together and think through how you're able to better connect that family to WIC services or to food banks, as an example. So these types of connective tissue across sectors can play an important role in ensuring that families have access to needed services. And then finally, on the next slide, we're supporting whole child health models. So what I just described, these technology networks, can be one piece of a broader whole child health model that exists in a community. And whole child health models really support health systems and other multi-sector partners in addressing the holistic needs, so the health, the social needs of children and their families. And these models help to support workforce development, the data infrastructure that I just discussed, can also support interventions. So for example, if a community comes together and decides that there is a need for more focus on early care and education interventions or interventions for young children that focus on equity and improving access to healthy foods or obesity reduction programs, there's this opportunity then to support that work through either an innovative payment model or to support it through other types of multi-sector financing. So these approaches really can help to get at the core values of reducing obesity and improving access to healthy eating and physical activity to support whole child health overall. Next slide, please. So in conclusion, there's certainly a lot of opportunity out there to improve access to healthy foods, to address food insecurity, and to do it in a way that's really focusing on those populations that really could benefit the most. I think it's a really important time for practitioners and researchers and those with lived experience to inform policymakers about what is needed, what is working, what the barriers are, and where the biggest opportunities lie. And I think through sharing knowledge and perspectives and research and experiences, we really can help to inform and improve many of the programs that are existing moving forward. So thank you for your time and happy to answer questions later.
Thank you so much, Daniela. As we move forward, I would like to introduce Carrie Doima. Carrie is a team lead of the Early Care and Education team at the Division of Nutrition, Physical Activity, and Obesity in the Obesity Prevention and Control branch at the Centers for Disease Control and Prevention. In Atlanta, Georgia, they are providing, and across the country, providing guidance and technical assistance to CDC grantees and partners on many facets of childhood obesity, including ECE prevention, population level obesity prevention strategies, and the evaluation of public health interventions. Welcome, Carrie.
Thank you. Can you hear me? I switched to phone audio. I had a little choppiness during Daniela's presentation. So thanks, Allison. So great to be here. As Allison mentioned, so I'm the Early Care and Education team lead at CDC, and I just wanted to run through a little bit about some of the policy system environmental aspects that we have seen successful and others that we are hopeful for. So next slide, please. As always, the CDC disclaimers, I'm speaking on behalf of myself and not necessarily do these thoughts or ideas represent the official position of CDC. Next slide. So early care and education, one of the most overlooked, underestimated, and powerful forces for good in America today. So I encourage you, if you haven't seen the 2020 documentary, No Small Matter, really outlining the potential and the ways that this sector really can change people's lives for the better, I encourage you to do so. Next slide. When many of you on the phone really do know that the ECE setting directly influences young children's behavior and can have ripple effects into families. They have direct control over how active children are every day and what they eat during the time when they're in their care. And they really can build a foundation for healthy habits. About 59% or 12.5 million children are cared for outside the home at least once a week, with center-based care being the most common type. Next slide. I wanted to pay homage to ECE here as the thoughts of being the Great Equalizer. So we know that education is a key equity driver in the United States. We also know that early care and education can impact short-term outcomes for children related to health and school readiness. One study found that children who participated in Head Start had significantly healthier BMIs by kindergarten entry than comparison children. But we also know in the long term, the literature demonstrates time and time again, participation in early care and education programs that are of high quality can improve long-term outcomes that we all strive to improve. So less substance abuse, lower adult body mass index, less cardiovascular disease risk, and also the social outcomes that we hope for people. So educational attainment, less crime, employment, and income. And studies also, many of you know, show the return on investment for ECE is high. Next slide. Next slide. I just wanted to go over some of the activities of our division, the Division of Nutrition, Physical Activity, and Obesity at CDC, to really support children and families in this space and early care and education providers. So DNPAO supports activities to improve breastfeeding support, nutrition, and physical activity for kids 0 to 5 who are in care. And we do so through a triple prong approach. So layering this idea of policy and system support, so supporting states to implement national standards contained in caring for our children related to our topic areas of nutrition, breastfeeding, and physical activity, among others, into state systems, which we'll talk about in a second. Supporting local communities and ECE facilities themselves, be it centers or homes, to improve nutrition and physical activity through their policies and the use of evidence-based interventions. And then finally, to support the ECE providers who are really doing the hardest work of all to implement everyday best practices related to nutrition and physical activity. So DNPAO does this through supporting partner work and then through supporting recipients who receive funding, and then providing technical assistance, surveillance, and other partner activities. Next slide. I wanted to let people know, so currently CDC is funding 3 state-level cooperative agreements, which we don't have time to go into detail, but in total, they support 33 states and the District of Columbia in the different funding streams and projects. 2 based on state-level work, so the CDC SPAN program, State Nutrition and Physical Activity Program, 16, and then also 12 recipients funded through a cooperative agreement with Nemours, and then 1 on farm to ECE. Local level, we have some CDC recipients working at the local level in our high obesity program and our racial and ethnic approaches to community health programs working to support ECE providers. And when you add it all up, DNPAO's programs cover about 3/4 of the children under 5 in the United States. And the message that we try to drive home with everyone is this work towards sustainable change. Next slide, please. One of the sustainable systems level changes that we are happy to say we've seen over the last 10 or so years is this state licensing work. So ECE programs are licensed by individual states. And CDC supports a review and a report annually on licensing changes related to states' licensing regulations on our topic areas. And the good news is from 2010 to 2018, 39 states updated their licensing standards to include more breastfeeding support, infant feeding, nutrition, and physical activity. And you can see from the diagram on there the color changes from 2010 to 2018. Next slide. Akin to the the next slide is on QRIS. There we go. Akin to the licensing work, you know, when we look at states and what they've done in their quality rating and improvement systems, and quality rating improvement systems are in 40 US states, and they really try to help facilities achieve higher levels of quality through a designation or a STAR system or some type of process like that. And so recently we reviewed all states' QRIS systems, and this is draft preliminary data, but you can see here, the darker the color, the more our topic areas are included in states' QRIS. So interesting colors there as well. Next slide. When we think about sustainable policy change at the facility level, we think about interventions that are evidence-based, such as the Nutrition and Physical Activity Self-Assessment for Childcare, or NAPSAC, as many of you know. The Harvard Cost Effectiveness Review found that among interventions focused on kids less than 5, NAPSAC shows the strongest evidence for impact on early childhood obesity risk. And currently 22 states are now using GO-NAPSAC to support local ECEs And many of these are funded through CDC's programmatic funding. States are also really working hard to embed GoNAPSAC into existing and important state systems, such as QRIS, or Technical Assistance Networks and Recognition Programs. Next slide. When we think about sustainable professional development, how do we help people understand the policies and the practices really that are helpful when it comes to our topic areas? Ongoing professional development, just like licensing, are state specific. And we know that currently 23 states have either developed or embedded courses into their state's professional development registry or requirements on our topic areas, which is good news. And CDC has also worked for several years now with Penn State Better Take Care to offer on-demand trainings in both English and Spanish. And I believe those have reached over 70,000 providers so far. Next slide. Just wanted to spend 1 minute on some of these other policy levers, which others in the discussion will spend way more time on. But one activity that has been undertaken by states in collaboration through the Nemours CDC Cooperative Agreement is work with Child Care Aware to think about those participating in the child and adult care food program within a state and those who are not. So maps like these help people understand, you can see those bright spots there, where there's probably high eligibility but low participation. So things that these are kind of policy level or systems level things that we can look at using data to help us target our efforts. Next slide. Finally, I wanted to leave with just a few slides on some of the examples of equity that we have seen in our ECE portfolio. So across the 3 different programs, we have seen many states advancing equity in very concrete and important ways. So we wanted to share some of these examples. We've seen them participating in the equity trainings and working with equity consultants. We've seen them making coalitions more diverse and inclusive in efforts surrounding those activities. We've seen building equity into state ECE strategic plans and being very intentional. Next slide. We've seen folks using an equity analysis tool and performing equity analyses on programs and initiatives, either ongoing or before they start, to make sure there are no equity implications. Next slide. And initiating work to understand food insecurity and Cacfp food program participation and mapping. Next slide. And finally, just really doing the hard work of performing outreach to diverse groups, making sure their coalitions are diverse, building trust among different stakeholders at the state level, but also among different organizations within a state, and translating and ensuring cultural adaptation of products. So when a state produces materials, either in the farm to ECE program or something else, really thinking about a cultural adaptation. Next slide. I wanted to spend 1 final minute on an example from the state of Iowa and then move on. So Iowa is funded by both the CDC Nemours work and also the Association for State Public Health Nutritionists, the CDC work with improving farm to ECE at the state level. So it's really awesome to see these states who have pulled things together. I think someone from Iowa is actually on the phone. Just thinking about how you bring it all together. So really in their work around farm to ECE, adopting a racial equity framework to inform their whole coalition of farm to school and farm to ECE. Thinking about those policy and lever improvements. So improving child nutrition by investing in the Cacfp initiative pilot. Trying to get more local fresh fruits and vegetables to children in care. And then, putting the pieces together with a professional development campaign and other efforts to educate providers and support them. Next slide. So finally, just pulling it all together. So ECE is a key equity lever, and we know this. DNPAO's work and the work of partners and those through our cooperative agreements impact states, communities, facilities, and providers. There's been lots of opportunity for additional work to help states advance their work, equity, and other topics in very concrete ways. And equity has been a very important underlying component and of recipients' work thus far in their cooperative agreements. I think that's it. Thank you. I will be happy to take questions. In the end.
Thanks so much, Carrie. Please, as Carrie said, the Q&A function is available at the bottom of your screen. You can definitely add any questions that you have in there, and we will integrate those into our conversation at the end. We really see that as an important part of this. I know we would all love to be in a room together right now having this conversation, but really want to make sure that that conversation is happening at the end of this webinar. As you continue to think of your questions, I'd like to introduce Stephanie Scarmo, our next speaker, who is the Senior Manager of Policy Research for Voices for Healthy Kids, where she leads the research and analysis efforts for the initiative. Previously, Stephanie served as an officer for the Kids Safe and Healthful Foods Project at the Pew Charitable Trust, a staff scientist for the Center for Science in the Public Interest, and a research associate at the Rudd Center for Food Policy and Obesity. Welcome, Stephanie.
Thank you, Allison. I'm really happy to be here today. You can go to the next slide. So very quickly, just a little bit about Voices for Healthy Kids. We launched in 2013. We are an initiative of the American Heart Association that works to pass policies at the state, local, and tribal levels that improve health and advance equity. Next slide. And we do our work in three main buckets. First, we have regranted more than $40 million over the past 8 years to fund advocacy campaigns across the country. And we are increasingly prioritizing funding small local organizations that are led by and representing communities of color and those with low incomes. We also provide technical assistance and training to advocacy campaigns. So that could be how to write an op-ed in your local newspaper, a spokesperson training, how to build a coalition or do grassroots work. And then we convene partners. So this could mean bringing researchers together, communications colleagues, or other formats to support advocacy efforts. Next slide. And so the American Heart Association advocates for strong obesity prevention policies in early childhood education settings. We know that childcare are important environments for promoting lifelong good health. And specifically, we've promoted the following two policies. So updating state or local childcare licensing requirements to include specific nutrition, physical activity, and screen time standards, as Carrie was mentioning in her presentation. And then securing funding to support access to quality early childhood education programs. Next slide. But I think it's also important to remember that there are many other policies that touch early childhood that you may not think of, or their families. So for example, SNAP access and fruit and vegetable incentives, or sugary drink taxes that use the revenue for additional spots in child supportive programs and services. And finally, an area of increasing interest is around family income supports, extending postpartum Medicaid coverage to make sure that mothers and babies get off to a healthy start, because we know that obesity prevention happens in the earliest years, and making sure we have access to WIC. And while the examples and successes that I'm about to talk about really touch on obesity prevention, I think we also need to remember that there is a bigger picture out there of making sure that children just have access to early education programs. There's a supply and demand issue that we can't ignore as well. Next slide. And so we've been successful in advancing policy in a few places, including some conservative states. So the first one that I wanted to talk about is a story from Kentucky. And this story is really about playing the long game. Healthy eating, physical activity, and screen time standards passed in Kentucky 2 years ago, but they weren't finalized in regulations until just last spring in May. And in the meantime, we had a pandemic. And so our advocates there and our grantee Child Care Council of Kentucky were successful in advocating for some CARES Act funding to be allocated for stipends for staff, could be used for food, could be used for PPE, or just keeping childcare centers open during the height of the pandemic. This has been ongoing work in Kentucky, and we were really happy to see the success. The next slide. There's also a great story out of St. Louis. This is an area that we at the American Heart Association came in kind of at the last minute, but the work had been ongoing for years. In November of 2020, voters approved Proposition R. It was during the largest election turnout ever in St. Louis history. And the proposition would impose a modest property tax that would increase, that's set to raise $2.3 million each year to go to early education programs in the city, which was very exciting to see as well. And we have thanks to the We Power Coalition that led that movement. Next slide. And while we've been successful in a few states and communities, it's not always just about passing policy. Sometimes it's about building advocacy capacity. So in Mississippi, it's really tough to get these types of policies passed, but there has been a lot of ground softening and creating noise around them. One example is the Mississippi Low-Income Childcare Initiative, which was one of our grantees. This is an example of a great report that they put out, but the story of Mississippi is really interesting as well. They were actually working to reverse policy that was preventing access to quality childcare education settings. So in 2004, there was a policy imposed where single mothers had to apply for childcare support in order to have access to the state's childcare assistance program. And this created many barriers for single moms who needed childcare to be able to work. So they tried legal options, they tried legislative, they tried regulations, and hadn't been successful. And so we funded the campaign last year that also raised awareness, but wasn't accessible, but continued to raise noise and make noise around this issue. And we know that they're continuing to work on it, and we hope that they will be successful in the future. Next slide. And it's not just about passing good policies like I was just talking about. Sometimes it's about reversing or repealing policies that get in the way of access to quality childcare education programs. The other thing that we keep our eye on at the American Heart Association is this term of preemption, which really means preventing communities from setting policies that might help, specifically in this case around access to childcare. So one example is in the state of Florida. In 2017, a bill passed that would preempt any local law related to employment standards. So this could mean minimum wage, paid or unpaid leave, health benefits, et cetera, that were stronger than what was being imposed at the federal or state level. And this obviously has huge implications for families with low income and the health and well-being of their children. So we need to keep an eye and play defense sometimes for other bad policies that might be passing that would impact the children and their families. Next slide. And then it's also really important to notice that this is a moment in time, and the pandemic has created some advocacy momentum. People really care about this issue, and COVID highlighted it. I'm sure many of us on this call can relate to this picture of trying to get some work done while childcare centers are closed. This also highlighted these needs for the business community, which has been really important in engaging in coalitions. One example is in Wisconsin, where this was part of their campaign slogan, the workforce behind the workforce. This is a nonpartisan issue. Businesses really need their employees to go back to work, and so we should be supporting childcare. And this messaging and bringing business partners to the table has been really effective in some campaigns that are ongoing. Next slide. And so if you're interested, there are ways that you can get involved in some of these activities that are happening in your own backyard. So here are a couple of links. If you have questions, you can reach out to me directly, but we would love for more support, more noise, more grassroots advocates around some of these policies that we are working to pass across the country. So thanks very much.
Thanks so much, Stephanie. Once again, a reminder, I know this is generating so many questions for me. I'm sure it is generating questions for you as well. As we move to our last speaker, Jerry Hinchey is the Director of Nutrition and Policy at FRAC. Jerry's work focuses on nutrition policies, such as increasing the healthfulness of nutrition programs necessary to reach the goals of eradicating domestic hunger and improving the nutrition and health of low-income individuals and families. And we look forward to hearing your report out here now, Jerry. Thank you.
All right, thank you, Allison. I'm really happy to be here today to be part of the Healthy Kids, Healthy Future series. I'm a big fan of the early innovation that Healthy Kids, Healthy Futures, fueled by Nemours leadership, brought to this idea that ECE really was important in terms of equity, food insecurity, obesity prevention, and good eating. So happy to continue to be part of that. So today, what I'm going to be talking about, if we look at the next slide, is in the context of advancing health equity in early childhood. I'm going to be looking at the federal nutrition programs, which support obesity prevention and food insecurity in early childhood. And I'm going to look at it in two ways. One, new opportunities for action, which is also a policy update, and two, what's going on in Congress. So if we turn to the next slide, if we think about the federal nutrition programs, we do know that they support obesity prevention and food insecurity in early childhood. We know that because there's a lot of research on it, some of which actually comes from the healthy eating research. folks who are really providing us with a lot of research fuel to make our policy arguments. So thank you to them. So we know that. What else do we know and what have we heard already? Well, we have serious equity problems, and COVID has only exacerbated them. And so if we think about food insecurity, we know with even the most recent data from April, the food insufficiency data, we have 1 in 13 white households have food insufficiency, but 1 in 5 Black and Latino families has food insufficiency. So we have serious disparities, we have equity issues. Those disparities are actually ongoing, but they have been exacerbated. So the point differences are even bigger in food insecurity. So we really do want to maximize all the resources that we have at hand. And we have all been working together to secure a lot of flexibilities and options, and we have even more ideas. So what I'm going to do right now is think about the new opportunities for action in the context of what policy changes have happened during COVID. So we're going to talk first about the Child and Adult Care Food Program, then the WIC program, then SNAP, Pandemic EBT for children under 6, and Farm to ECE, all pretty quickly. So if we go to the next slide, one of our big wins that we got through the waiver authority from USDA, thank you to them, muchas gracias to USDA for this, was that they waived the area eligibility requirement for family child care and Cacfp. By waiving that area eligibility requirement, that meant all the family child care homes could get the higher rate, which is really what it takes to participate. So this was really important as far as equity, particularly in rural areas and actually suburban areas that don't have quite the concentration of poverty, but actually have quite a few poor households and low income providers. So we did a lot around outreach on this, and people can still be promoting it. It may be limited right now because one of the policy issues that we're going to talk about in terms of Congress is that we would really like to see this authority extended. But for now, it's still in place, and you can still talk to people about it and engage your partners on it, and get people on, and at least they'll be on for now, and maybe they'll stay on. Okay, so if we go to the next slide, what's one of our other big opportunities? Well, one of the things that when we think about ECE, and we've heard so many great things that people are doing in ECE to support equity and good health and food security and obesity prevention, one of the important things to do is not only to make sure that the ECE meals and snacks are healthy, which Cacfp does and many of these other initiatives, but to make sure that the families have what they need when they're at home as well. And one of the big important programs is WIC. What's a big opportunity here now in WIC? What's a big new policy change during COVID? The plus up on the WIC food package. Instead of $9 and $11, now we've got $24 a month for children and $43 to $47 for women. This is really important. And it's important because of the issue of equity and the consumption of fruits and vegetables and the importance of meeting the dietary guidelines. And it's also important because there are huge equity issues in what's available in stores in lower income and under-resourced communities. And we know from research that when WIC makes these changes, it actually improves what's available in stores for everyone. So depending on the kind of work that you do, this could be very meaningful. So if we go to the next slide. So we have a whole outreach toolkit, which you can use to really promote this. And you can promote it to let people know that they can get on WIC and get this now, but also just promote it generally. You know, this is really important. There's more fruits and vegetables that people can get, and that the store should be doing the best job that they can. So one of the advantages I think this has also for ECE is that the lessons that kids are learning in ECE about fruits and vegetables, sometimes they take them home and to their parents and want various kinds of fruits and vegetables, but the parents can't afford them. Well, if they're eligible for WIC, this is one good way to look at that. So let's look at the next slide. So what's another thing that's really important that happened during SNAP? The benefits increase. So in one way that's permanent, in one way it's not. But the way that it's permanent is that USDA used their authority and followed the direction of the last farm bill to permanently increase the base benefits for WIC, for SNAP, the way that it is calculated, and that's called the Thrifty Food Plan. But that is a permanent increase. So SNAP families are really going to have more benefits so that they can make the kind of purchases they need to get to the end of the month. So if we go to the next slide, the other policy thing is pandemic EBT. So at first, pandemic EBT, which is money to replace the lost money from child nutrition programs during COVID, that program did not serve children under 6. It was only for kids who missed out on school. But we know that kids were missing out on Cacfp. They were missing out on childcare meals even without Cacfp. They were at home and childcare was shut down. So we really worked hard with other people and tried to make sure that there was going to be pandemic EBT for children under 6, and it's for children who are under 6 on SNAP, and it has been extended. Now, one of the things that it's really important is to get this out here, and we have a toolkit on that as well. But most recently, USDA really, and this is great, simplified how this is going to work for this year. So it's basically based on how the losses in the child and adult care food programs. So if you compare like this last 4 months, August to December of the data that's available for 2020, you go back to 2019 before COVID and you compare that, there's a significant difference still. So it ranges from 18% in some states to 45% in other states, the gap between what people were getting for Cacfp and what they are now. That gap is what's going to determine the level of benefits all the children on SNAP under 6 get in a state. The state has to decide to do this. So this is a big policy deal. You want to make sure your state is doing this. So if you're in a coalition or you have some kind of voice, you want to raise it to your state, tell them it's really important and the kids need this who are under 6. So let's go to the next slide. This is a really new policy development, and hats off to the National Head Start Association. They tried to get this through 3 administrations, and now the Biden administration has worked with National Head Start Association, and SNAP participation can now be used as categorical eligibility to qualify for Head Start, which is very important for families who might want to participate in Head Start. It's automatic eligibility for them. So really, really important from an income point of view. So lots of opportunities for you to partner on outreach around this. And if you work on anything to do with SNAP or any kind of outreach that you do there, you can work with the Head Start folks in your state. This is a real opportunity for partnerships and sharing information. And again, hats off to the National Head Start Association. So finally, I want to conclude, and we already did hear from Carrie, that we have a lot of ECE money coming down that's related to farm to early care and education. This is a guide that we did with ASTAFAN and Policy Link and FRAC. So this shows you what those are, but they're real important for equity. And now finally, I just want to move to the next slide. This is the second quick part of what I'm going to say. If we're thinking about advancing equity in early childhood and we're focusing on the federal nutrition program supporting obesity and food insecurity in early childhood, there's 3 different congressional actions that we're looking at. The first one is the economic stimulus bill. So it's been called a lot of things, but it's just general now, and you hear a lot about it. You know, we want some important changes in there. That's the same vehicle that people were hoping to get a lot of early childhood changes in, and everyone's still working on that. One thing that's really important is when we think about these waivers, because Congress didn't automatically extend them, for example, the waiver for area eligibility and family childcare, we want those waivers extended. So that's important, and it's important to educate people about that. The other thing is the child nutrition reauthorization. I will conclude by saying just a few things about that. And then the third is the Farm Bill, which is SNAP. That's starting now, but it's not intended to be passed until next year. So if we go to the next slide, the child nutrition reauthorization for Cacfp, which is what I want to focus on because that's early care and education and it's important. We have that bill in the House and the Senate. They're both great. If we go to the next slide, I just want to focus on some key things that are in both bills. These are really important if we're talking about equity and supporting equity in early care and education, and the disparities that we see in the ability to eat healthy and to have food security. One of the main things this bill does, and what we want to see in the reauthorization, is that it gives the opportunity for providers to serve another meal and snack for kids who are in care a full day, which is consistent with what they should be doing and all the standards. So that's important. And the other thing is that it streamlines eligibility and eligibility determinations, and it reduces paperwork. So basically, that's my policy update. There's a lot of opportunities that we're excited about, and we hope you are excited about as well. And the federal food programs are important to supporting food security and obesity prevention in early care and education and early childhood. I'll turn it back over to you, Allison.
Thanks so much, Jerry. And as you can all see, the slides are coming down, and I invite Jerry and Daniela and Carrie and Stephanie to come back on screen so that we can have a conversation with faces. And before we start to go to the questions that are coming in from the participants, and I see they are starting to come in, I have a couple of questions that I want to take the moderator's prerogative to start us off with. What are, and a lot of these have been shared, but if you had to prioritize, what are the current legislative and policy opportunities that will advance food security and childhood obesity prevention to really achieve more equitable health outcomes as this work is moving forward?
Allison, I could start quickly. I think, first of all, making the child tax credit permanent would just be huge. And I think that that's a really important priority that Congress should reconsider doing because of the strong connection between poverty and food insecurity. Completely agree with what Jerry said about extending many of the waivers that have been put into place throughout the course of the pandemic. That would also be helpful. I also think the White House Conference is another good opportunity, and I would encourage advocates who are interested in the kind of confluence of early care and education and food insecurity and obesity to really try to highlight how that conference can help to amplify solutions within the ECE sector. So I think that I would encourage advocates to think about engaging in the listening sessions and the stakeholder meetings to make that point.
Great, thanks, Daniela. Others want to weigh in?
Well, I guess I'll just reiterate, yes, what I said, and I completely agree with Daniela. We want to really take these lessons learned from COVID and we want to make them permanent, right? So the waivers that we have that make it easier for these programs to work, it makes it easier for people to access the programs. We really want to keep those. There's no reason not to. So for example, WIC has remote access now. They can get, you know, all the care that they need over the phone. Why not keep it that way? Why not keep that an option? And we've already talked, we would really like to see these waivers on area eligibility continued as far as the ACFP is concerned. And there's a whole host, I think, of those kinds of things. And part of it, I think, is from a messaging point of view, is talking about, well, you know, these are things that help people live healthier lives, right? They can, and it's not just when they're young, right? This is going to influence their habits the rest of their life. It's going to influence, in some cases, their earning power the rest of their life. So I think those kinds of messages really go a long ways. I think the other thing that I thought was interesting, and Stephanie was talking about this, is how do we, in essence, strike while the iron's hot? Right now, people still care and they think that offering all this help is important, but you know, that window is closing. So really just trying to move forward as quickly as possible and be clear. And just to say one more thing in terms of the regional listening sessions, there you can go on the White House Conference has a link that Daniela was talking about, the listening sessions. They're going to have regional listening sessions, and they are actually going to go pretty quickly. So, you know, you have to sign up to say what you think and to tell your story or to get people who are your constituents. And there will also be one in Spanish. So if you have constituents who are Spanish speaking, you can link to those. But I really agree with what Daniela said and actually the rest of the speakers.
I can just add, I think at the state and local level, I would agree. So many of these federal issues can also be pursued in different ways at the state and local level, especially ensuring that there are quality child nutrition, physical activity, and screen time standards, as Carrie was talking about. But I would also encourage us to think about some other policies that really affect children and young children and their families. So as I was trying to mention, I mean, things like minimum wage issues are coming up for childcare workers. We can, impose all the nutrition and physical activity and screen time standards we want, but we want to make sure that there are also access to seats in those programs and making sure that childcare providers are paid well in addition. So lots of other policy opportunities.
Great, thank you. And I know Carrie is having some internet issues, but Carrie, you talked a bit too about policies and systems changes that are happening in the states in terms of the QRIS and other measures. Is there anything there that you think are priorities that we should ensure are moving forward?
Yeah. Can you hear me now?
We can hear you.
Okay, it's a triple mute today, not the double mute. I would just say just thinking about and continuing to watch and support states who are incredibly innovative and doing some amazing work. So for instance, if a state really hasn't had success with licensing, well, they can drop some of the things into QRIS, and so or vice versa. If you've had success in licensing, you're required to be licensed to be in QRIS, then you can offset some of those things. So I would just say, continuing to support states, continuing to think about these innovations, these recognitions. It's the layering effect where you can layer different strategies and approaches on top of each other.
Great. Thanks, everybody. Which leads me to ask the question of what are the barriers and even the accelerators to addressing food security and obesity prevention that could be overcome with some of these policy systems or legislative changes?
Well, I often have this slide that has a picture of an angry cat on it. And it says, there's too much paperwork in this program. And, so I feel like if you think about barriers, that's one of them, like there's too much paperwork. And while we're all laughing, part of the problem is that in federal programs, not only is it a lot of work to do that paperwork, but if you don't get it right, it's risky. So you have this bad combination of a lot of effort and an almost impossible standard in some cases. And if you don't get it right, then it risks your participation, not in that program only, but your other programs. So that's why one of the things that we really want to see in the reauthorization is to reduce that paperwork, but also address that risk point and say, we know we have a serious deficiency system, which is the name of it for those of you who don't know in Cacfp. We have this system and it's for integrity and it's important, but sometimes it gets out of hand. So and this is really important for equity, because if you think about the providers who are running childcare and all that they have to do, if you think about childcare that is in under-resourced communities, there's a lot of reasons why they're actually more likely to get into trouble with these programs, right? It's harder for them. They've got more to do. And in some cases on family childcare, they may have lower literacy levels. So it really is an equity issue. If the program is too hard and too scary for people to even consider, then things have to change. So I think that's my answer to your question, Allison, about early care and education support through Cacfp. I think we have to make it easier and we have to make it less risky. It has to seem more fair if we want to address equity. And I would add that I really like the maps that Carrie is showing. We have some maps like that too, but I love her hotspot graphic because I think that's really important. You see there are equity issues. And if you ask the people in those hotspots why they're not participating, they'll give the angry cat answer and they'll say it's risky. And so we have to do something about it, right? We just have to fix that.
Thanks, Jerry. Other barriers or accelerators?
I think just thinking broadly about many of the families who are dealing with poverty and need to access a wide variety of federal programs. It could be nutrition support programs, it could be Medicaid, it could be housing programs. These are programs that are run by so many different parts of the federal government and administered by so many different state agencies that I think that siloing in and of itself can be a barrier. Many states have instituted structures like children's cabinets to try to help create more coordination across sectors and across programs. And I think that's something the federal government really could think through as well. In the past, we've seen things like memorandum of understanding in between different federal agencies. On the early care and education side, for example, I think it was between the Department of Education and HHS under the Obama administration. So I think really trying to get more coordination on the federal side to better understand like just some of the barriers that Jerry just raised. How do we streamline programs? How do we make them easier for families to access? And how can we better coordinate? So structures like children's cabinets on the federal level or just any interagency structures to try to kind of cut through the red tape and make it easier for families to actually access the programs to which they are eligible, I think would go a long way.
Great.
So I've that when Daniela said that, it really made me think of another thing too, which I think is a cross-sector issue on the local level that I see a lot related to the federal food programs and food security and equity work, and that is the role of the healthcare sector on the local level, which I really think is important. And so I don't know if Nemours or Stephanie or someone else would like to take that on, but I believe, Daniela, part of what you were talking about in terms of your legislative recommendations is partly related to that. But I definitely see that in our state level local anti-hunger work. It's a huge equity issue with healthcare sectors really stepping up in some places.
I agree, Jerry. One of the things that we're seeing increasingly are these medical and legal partnerships between a healthcare setting and a lawyer, for example, that can help connect patients to services like WIC or SNAP and help make it easier to apply for some of these services. So that's one such initiative, but there's a lot of other ways for healthcare settings to help with some of these food security initiatives. And then I would just say another accelerator is probably diversifying coalitions around some of these advocacy issues. So bringing in the business community, bringing in healthcare sectors, bringing in some non-traditional partners to lend a voice and make some noise around these issues has been really helpful.
To kind of amplify what you both said, we're exploring some of those options too. So we've implemented a screening tool in many of our primary care sites to try to identify needs and then actually have community health workers and others who can help families connect with those needs. We're testing out a medical legal partnership as well. We also just joined the Healthcare Anchor Network so that we can really think holistically about our role as an employer in the community and trying to make sure that we are providing families who work for us with all the supports that they need as well. So definitely a really strong role that the healthcare sector can play.
Yeah, this is Carrie. I would just say too, just that the use of the food insecurity screening questions. So in Vermont, some child care facilities are actually using those, and it's kind of embedded in some of their work. So it's really, maybe they are not, admitting things at the pediatrician's office, but maybe the child care provider just has a different level of relationship. So equipping people with the right questions and resources in this surround kind of way to help support families in whatever setting they happen to be in.
Thank you. Carrie, I think you hit a really big point there, that who asked the question is sometimes as important, if not more important, than the question itself. And I know we all aim for efficiency and non-replication, but sometimes knowing that multiple people are asking the same question about the needs of families and kids can lead us to finding out more about what the issue is and what the needs are of the communities. And then especially when that data can be rolled up and social needs become population health needs, and we can really start to look at what are the system changes that need to happen in order to bring change for multiple parties and to break cycles, quite frankly, so we're not always reacting, that we can also be moving the work forward proactively is a really great opportunity. Thank you all on that. One last question before we go to the questions from the group. What research and evidence are needed to advance progress on childhood obesity prevention and really start to make the compelling case to policymakers?
I have one.
Carrie, can you hear me?
Would love, oh, sorry, Carrie. I was just going to say, as we work on securing funding at the state level for some of these programs, I would love more evaluation. I would love to see if those dollars are actually going to the child care centers and family child care homes that we are hoping they are going to. I think that could make a really important case for reducing some of the gaps that we're seeing and understanding that equity impact of the appropriation work that is happening.
Yeah, this is Carrie. So there's so many ideas and thoughts that I have. I think too, it goes beyond research and perhaps into surveillance. We at CDC last year successfully fielded for the first time a 4-state pilot in a representative sample of ECE's centers in 4 states, Florida, Ohio, New York, and Arizona. And that really has started to provide us some really great data. So about half them participated in CACFP, half didn't. Looking at the policies and practices, the serving fruits, the serving vegetables, the celebration policies, the physical activity, the time outdoors. So I think it's a 3-pronged approach, really. There's research, and that definitely helps. There's evaluation that Stephanie just mentioned, which is crucial. Well-designed evaluations really can resonate and speak to those who are in positions to either take in information to make policy or support things happening at a state. But then there's also these surveillance activities that we will finally be able to, understand at a state level what the uptake is and some of these best practices that we want people to see and where are opportunities for supporting people. So for example, in the data, hardly anyone is serving sugar sweetened beverages, like 97% said they weren't. So maybe we shouldn't, be harping on that anymore, but maybe we should be harping on or helping people with, physical activity or other aspects like that. So I think it's many things that we need to do. Research is very important, and we are doing that. And then the evaluation and surveillance that comes with it.
The only thing I'd add to build on that is I think then the last piece is kind of how do we translate that research or the surveillance into clear, crisp, concise messages for policymakers so that it becomes real to them. And I think when possible, pairing some of the research with stories from folks who've been served by the programs and have lived experience with the programs can be a really powerful way of presenting it as well.
I think research has been absolutely crucial to all this. As I said to start with, I think ATR's done a lot of really good research. And I agree with Carrie that the surveillance is absolutely crucial. Not only does it give us ongoing and comparable data, but it has the authority of the government. So I think funding that is also important. I think one thing to build on, what people are saying, if you think of it from a policy point of view, what kind of research and evidence do we need? I think for ECE, it's important to really be thinking about what are the arguments that people have been advancing that oppose what it is that we ultimately want to see, and then think how do we research that? How do we show the value of this in terms of equity, in terms of impact, in terms of cost benefit, a lot of which I think is ongoing, but I think if I was going to target, I would be thinking that way because some really important ECE changes that everyone thought we were going to get, we didn't get in the end. Like we got really close, but we didn't get them, and they would have been important for equity. So really trying to deconstruct that failure, some of which has to do with larger political trends, but some of it has to do with some very pointed arguments, which I don't think make any sense. So I would like the researchers to make that point. That doesn't make any sense. Don't vote based on that.
Great. Well, thank you all. We've got a number of questions for you that I'd like to share. And the first one's for Carrie. In your presentation, you talked about providers implementing guidelines. And the question is, how do you know providers are actually fully implementing the guidelines? For example, are there health outcomes that may indicate children are in fact receiving the nutrition?
Well, yeah, that's a great question, and kind of alluding to what I said earlier, surveillance. So So we're really trying to build this out. We've been trying to do this for years, but thinking about the policy surveillance that we're able to do now with QRIS and licensing, and then going down to the facility level surveillance that we piloted that had it was fielded during a pandemic, but in one state we got a 27% response rate. It's pretty good. But also then trying to go to the child level outcome. So we are trying to, can you hear me?
Yes.
Okay, great. Going to the child level outcome. So in the next 2 years, we'll have exciting data from the National Survey of Children's Health, which will produce national estimates and state-based estimates on fruit consumption, vegetable consumption, sugar sweetened beverage consumption, and 2 physical activity proxies for children 1 to 5. So really, we're building it out as we can. So thinking about how we can capture data at every level to understand if things are being implemented and that does have an impact on children's behavior or consumption. So thinking about how we can do that with a specific nutrition topic like fruit and vegetable consumption, or even if you think about some of the licensing work, our states who have implemented licensing updates or policy changes, is that happening? Do kids really get 120 minutes of physical activity in a facility? So figuring out how to capture that data on multiple levels is something that we've really been working on, and we're going to continue working on because those will provide us the answers.
Great, thanks, Carrie. This one is also for you in terms of, or I believe, because the question was asked to the second speaker. You mentioned efforts being taken to understand food insecurity, and if there are more specific examples that could be shared, how are providers attempting to understand this issue of food insecurity? And I actually open that up to everyone, including Carrie.
Yeah, I can start if you want, but I know some collaborative activities with through the CDC Nemours Cooperative Agreement have tried to work on this issue. So receiving support and technical assistance from Share Our Strengths, and an opportunity where states had to avail the opportunity to think about participation in WIC or SNAP. How could we equip ECE providers to understand different nutrition programs that families might be eligible for? So that was an opportunity. And then, yeah, I think it's in states like Vermont, who through their farm to early care and education work, we've learned that they do ask some standard screening questions, and they do have different ways of embedding that into their programs. So I think it's just little by little, and I'd welcome the ideas from other panelists.
Giving time for others to weigh in, but not forcing.
Well, I agree with Carrie. I think the key thing is that people in early care and education are really focused on the food security needs of their children, if they're, in under-resourced communities, or they have children whose families have lower incomes. I think they think of it from the point of view of what they're providing, but also they really do think about, are the children going to have the right kind of food or enough food when they go home? And they can tell sometimes. I mean, all the people who are here on the webinar with us, the audience, they probably see it too, that sometimes kids are they'll come in on Monday, they eat till they're sick because they just didn't get enough over the weekend, or they want to take stuff home, even if they're small. So I think we hear stories about that all the time. So I agree with Carrie that I think that referring families to the other programs like SNAP and WIC are good. And there is an interagency policy memorandum on that, as Daniela said, that focuses on making it easy to make those referrals. I think one of the programs in ECE that has the best standards for this kind of stuff is Head Start, because they really do assessments, and they really often have good relationships with the WIC office and can exchange data and different things like that. But I think it matters overall. And what I really saw during COVID is that people in ECE started paying even more attention to it because so many more families were struggling. So ECE providers, even if they were closed, were staying in touch with their families and trying to tell them about, you know, there's SNAP, there's WIC, but also telling them that they could go and get the grab and go meals at schools because schools were serving all ages. And while some CACFP childcare did grab and go, the majority of it came through the schools because they could serve the kids under 6, so the families went there. So I think we see a lot of you know, renewed understanding of it, and some ECE like Head Start. I was on a webinar with the Head Start people that about, you know, halfway into COVID, and they were using their Head Start funds to buy food and give it to the families who were at home. So there's been a lot of really impressive work.
Great, thank you. A quick clarifying
Jerry,
question. Go ahead,
sorry,
Carrie.
I was just going to say, Jerry, you'll be happy to know that we asked on our survey of the ECE director, you know, how often they saw food, or their staff, how often they or their staff saw kids who appeared not to be getting enough food. So a little bit subjective, but still worthwhile. And the good news is there wasn't a lot of often or very often, but there was definitely some in that sometimes bucket. So I'm happy to share that data offline, but I think that's the kind of information that we also need through our surveillance efforts.
Yeah, and I think that makes a lot of sense, Carrie, because, you know, if you as the CDC say that, you collected that data and you report it, I think people listen to it. So I'm happy to hear that you're doing that. That's great.
Great. Quick clarifying question from your presentation, Jerry. The WIC benefit package increase, is that a permanent change or a temporary change?
That is a good question, and I should have made that clear. So it is temporary. So we want it to be permanent in the reauthorization. I didn't go through everything that we wanted there, but we definitely want it to be permanent in the reauthorization. So, you know, first it was passed for a certain amount of time and in the American Rescue Plan, and then it was continued through the appropriations and through administrative action. So now we have it in the appropriations to the end of the year. So I think that it's, we're definitely set, you know, for another year, another fiscal year, but we need it in the reauthorization in the interim to keep it going.
Great, thank you. A number of you spoke about the importance of multi-sector intersectionality of the different services that serve families. Is there currently any work occurring that would facilitate participation of, for example, Medicaid enrollees in SNAP or WIC? And the question asker points out that currently less than 50% of eligible children are participating. Are there opportunities here for us to leverage?
Yeah, I think there are a lot of opportunities there to leverage. I think there are some really good actually examples of that. So one is on the state level where people get a memorandum of understanding, and they do two things. One is they give access to the SNAP rolls. And so the local clinics can immediately find out who is on Medicaid. And so therefore, if they're on Medicaid, they're automatically income eligible for WIC. So that's streamlining eligibility. The other thing that we've seen states do with that memorandum of understanding is that they run the WIC rolls against the Medicaid rolls. And so everyone who's on Medicaid who would be categorically eligible for WIC, they do some, either they give that information to WIC to do outreach or they do outreach. So you both can streamline eligibility, but you can also identify and target outreach. So that's a state level interagency, SNAP and WIC, and then taking it down to the local level. The other thing that's really important here, and this gets back to our point about the importance of the healthcare sector and food insecurity and equity in early childhood, There are a lot of big kind of healthcare providers that are doing outreach on WIC, which I think actually you guys know more is one of them. So, and some of the ways that people do that is that they have a kind of a screening tool. And so it's not even as complicated as asking the food insecurity question. It's that you see that the person, your practitioner or the case manager, or whoever that person is, sees that a pregnant woman is on Medicaid, or a child up to 5 is on Medicaid. And then they let the person know, did you know if you're on Medicaid, you are automatically income eligible for WIC? You should apply if you're not, and connecting them. So there's definitely that connection as well. And the rates of participation, coverage rates for Medicaid and WIC vary a lot by state. Part of that has to do with whether they have that kind of memorandum of understanding, but the other thing has to do with actual coverage rates. So in some states, Medicaid is plussed up, and then in some states it's not. You know, some states it goes to higher levels, and some states it doesn't. But it's all makes somebody automatically income eligible for WIC.
One thing just to add in the context of the public health emergency now is CMS actually issued some guidance that basically said that states have the flexibility when Medicaid redeterminations are made after the end of the public health emergency, at a time when we're expecting a lot of folks could lose their Medicaid coverage, that states can auto-renew Medicaid eligibility for beneficiaries under 65 who currently are receiving SNAP benefits. So that's a flexibility that states can take up. That would be really important. I know it's something that we're definitely concerned about is when the public health emergency does end, what is that going to mean for the millions of children who could lose Medicaid coverage? So looking at something like this, like using SNAP to help determine eligibility as the redeterminations are made, could be a really important and powerful tool for states to take advantage of that flexibility.
Great, thank you. In an effort to get to the last couple of questions before our time runs out, let me ask, because as we all know in our work, physical activity and nutrition tend to be very much linked. We were asked, in existing and in-process programs and legislation, is the quality of childcare outdoor physical environments best practices addressed, including physical activity and gardening infrastructure?
Can you say that again? I mean, I think, you know, there's tons of efforts underway with partner orgs and different folks in the field to improve the physical, or the outdoor learning environments of ECE programs, because we do know that there are a set of best practices that actually Texas just made a designation program, and it has 12 best practices on a sheet. And it helps providers understand those best practices, and then when they accomplish them, they're designated as an OLE, an outdoor learning environment, in the Texas recognition program. So yeah, there's tons of efforts underway too, and they are one, you know, taking time to build capacity so people really understand what high quality outdoor learning environments look like, and again through the partnership with CDC and the MORS. You know, hundreds of people across states have been educated and afforded the opportunity to understand the outdoor learning environment, and through a course, and to improve quality there. So I think there's a ton of opportunity right now, especially with different aspects in states around, you know, just either CCDF or some of the Build Back Better or some of the ARPA funding. Allowing facilities to make allowing facilities to make improvements. So
great, thank you. And one last question. We have talked a bit about improving equity, and also about the angry cat meme that Jerry mentioned quite a bit about paperwork. And so our last question is, what impact has the availability or not the availability of having this in multiple languages meant for equity in access to these programs?
Well, I think it's really important to have all the applications and materials in multiple languages, and we've always really pushed that. I think it's also really important because of the prior administration and problems around people thinking that these programs are public charges, that they understand that they're not. And so, you know, Allison, to your point earlier, and Carrie's like, who's the messenger and who's asking, people really do trust their early care and education providers. And I think early care and education providers can, if they say this, you know, everyone can participate. It's not going to count against you when you're going to try and get citizenship, that is a message that people can carry forward. But I think the languages are important. We have seen USDA's doing all of their nutrition education training in both English and Spanish now, very impressive. So really, I think we've seen great progress from that, you know, that perspective. And Insecurity not in her head, so I'm going to turn it over to
Carrie was just giving her nodding agreement as we move forward. Well, I just want to thank all of you, Daniela, Jerry, Stephanie, Carrie. Thank you so much for your time today. In addition to all the questions, there were many comments thanking you all for sharing this really important information. Jerry, I saw that you shared one of the upload documents that people were also asking for too. As I mentioned at the beginning of the call, this is our first of 4 webinars. We will follow up with an email sharing the slides, where postings of the webinar recording will be, and also the registration information for our other webinars, which is the next one is coming up quite soon in June, being moderated by our friend Megan Lott from HER, focusing on research, and hope to see you all there, and you can all bring a friend as well. As the work moves forward, we're happy to continue to share and stay in touch. And thank you all for sharing your feedback with us, as well as any stories that you want to share as well. So thank you all very much, and look forward to seeing you on the research webinar for Healthy Kids, Healthy Future coming up on June 15th. Thanks so much, everybody. Have a great day.